I wasn't actually very shocked, surprisingly enough. I thought I may have been. I was kind of preparing myself before I went into the consultation with him. But I wasn't shocked, and one of the reasons I wasn't shocked was because I'd taken a lot of time in previous years to do some research about prostate cancer and what it means. And one of the alarming factors that I found was that most men die with prostate cancer and not from prostate cancer. And I guess that's been my driving force throughout this whole process, knowing that surgery is not the be-all and end-all of options for this disease. The specialist, rightly so, suggested that we should have surgery, or I should have surgery and a biopsy. The specialist rightly suggested that I should have a biopsy and then consider surgery. But I was reluctant to do that right from the word go, and I didn't make these feelings known to him because I understood what his reaction would be. So I left it at that and then consulted with my doctor. She was a wee bit alarmed that I was not going to consider surgery, but I was convinced that I could combat cancer following my successful battle with cholesterol many years earlier by resorting to a different lifestyle change using diet and exercise. In recent weeks, I've pushed this to the limits by resorting back to a plant-based diet and taking supplements, vitamin supplements, especially vitamin D. And also I've consulted with a doctor in the US who I hope to be using for treatment. He has a good success rate, and the process that he uses does still involve chemotherapy, which at first I was alarmed about, but when I heard the process that he takes, I was a lot more relaxed about it. His process basically involves injecting a small amount of insulin into the body to close off what he calls as good cells. At that point, we inject chemo into the body, and the only cells which are left open are the cancerous cells. The cancer cells receive the chemo and are subsequently killed off. This process can take between 2 to 5 to 6 months, and it does mean to say that I'll have to travel to the US to have this treatment. My doctor has been extremely supportive throughout all of this. I consult with her on a regular basis. She's provided me with the ability to have regular PSA tests, which again I don't believe are an accurate marker for prostate cancer, but they certainly are a marker of kinds. And I guess if my levels were down at 1 or 2, then I certainly would have less of a chance of having prostate cancer. So I do keep an eye on those PSA markers. Again, generally it's going to be for her consideration, but if I can see the results reducing, then I'm going to be quite happy about that as well.